Friends, if you have questions about mercury, why it's bad, how it gets into your body, what happens when you have mercury fillings, how do you detox from it, what you should expect, we have the ultimate episode for you. Welcome to Your Mouth Matters. What's up, everybody? Welcome. We have a full house in the studio today. We have, of course, Dr. T's here, Dr. Isabel is here, and we have our guest superstar, Dr. Angela Yeagley.
Thank you. Happy to be here.
Yay, I'm super excited.
So I know mercury is something that we've talked about a lot on other shows, but I know it's something that in the clinic we talk about almost every single day.
Yeah, it is. I'm constantly having this exact conversation that we're going to have today. I'm super excited to be able to share more and have Dr. Yeagley as like our expert, because I'm definitely not a mercury expert. I have my own story with mercury toxicity and my own path, or my own detox path and experience. But there are so many patients that come into our office that have had mercury fillings placed, that are worried about their safety, worried about potential toxicity, and they come in wanting them removed, which we can do. But it's really important, if you've had mercury fillings, that you are evaluated to see if you potentially have other mercury that's built up in the body. And the reason why I always emphasize this to patients is because they did a study with sheep. We talked about this in another podcast. They did a study in sheep where they placed mercury fillings in sheep, and they tagged the mercury. And after 30 days with these sheep with the fillings, they sacrificed the sheep and they did body scans. And they found that tagged mercury was in almost every single organ in the sheep's body. It was in the heart, the kidney, the liver, the brain, the bone. And so that was really concerning. So of course, they presented this research and they said, oh, that's a crap study because sheep are grazers. Humans aren't grazers. They're not eating all day long, every day. So they ended up saying this is not really great research, probably not what's happening in humans. So they did it again in monkeys, which are more human, and they had the exact same results. So when I tell patients this study and about this, their eyes go, whoa. And so I always tell people the easy part is getting the mercury out. Like, we can easily take a filling out. That is no problem. You can come in, we can remove them all in one sitting. Dr. Isabel has an amazing safe protocol that helps reduce exposure of mercury. We're very thorough when we remove things to avoid excess exposure. But what's left inside of your body? What's built up? And the question, or that question always comes up, and the answer is, I have no idea. So this is why we end up sending a lot of patients to their naturopath or functional medicine doctor to do more testing and detoxing to make sure that we're getting all of that out of the body. And so I'm really excited to have Dr. Yeagley on today because I think she's one of the number one people that we refer to for metal detox. It's so awesome that she's in Edmonds. But I think that we talk, like I said, in our clinic, we talk so much about the mercury in the teeth, but there's this huge other piece. And that's something that's on our scope. And so if you just take the mercury fillings out, you may not really be giving patients all of the support and really zooming out and being comprehensive.
And it is amazing to see the changes in patients when we remove the amalgam fillings or the mercury fillings. And one of the things that I tell them is that you need to check because you don't know how your levels are in your system. And if you have maybe one surface filling that needs to be removed, it might be okay. But if you have a full mouthful of mercury fillings, you don't want to have them all removed at the same time without checking with your doctor and see what's going on. So as Dr. Taylor said, to be able to remove this mercury filling, we need to prepare not only the patient, but the staff and myself, right? Because we want to protect the whole team that is working when we remove the amalgams. Because one thing is that this patient that has mercury fillings in their mouth, what they're doing is that they're swallowing multiple times a day. So they're swallowing this vapor of the mercury filling all day long. So what is that doing in the system? And then Dr. Yeagley is going to explain a lot more of all the different things. But I have a patient in particular that he had a few mercury fillings and his digestive system was really messed up and he was having a lot of brain fog. He was having a lot of symptoms and they were not able to figure out what was happening because all the labs were normal. But then he said, as soon as we removed the fillings, my body started changing. My digestive system improved. My brain fog is gone. So changes like this that you would think that they're connected with something else, they were connected with the Mercury fillings because that was the only thing that changed.
It's amazing.
So it's amazing.
And I think it's important to remember that some people are genetically going to be able to detox a little bit better. Like you may not have any issue with your MTHFR gene, or there's other genes that are linked to detox and mercury. And so some people, that mercury goes in and it stays. And other people, once you remove a little filling, then it starts to detox on its own. But everybody's different, right? It's not black and white. Dr. Yeagley.
Yes, ma'am.
Can you tell us about types of symptoms would patients that have mercury or heavy metals, what kind of symptoms do you see most commonly?
Yeah, we are definitely on the same page. When we have patients that come in that have mercury fillings, I absolutely am going to send them to a holistic or a biological dentist that I trust, which would be both of you. And we are also so glad that you are both in Edmonds and a fantastic resource for our patients. So thank you. So metals are something actually I've been passionate about for a long time, ever since I was in school. And mercury is definitely one of the big ones, along with lead and arsenic and cadmium. But a lot of people do have that additional exposure from mercury, of course, because they have the mercury fillings. Or people, sometimes I feel like they mistake. They're like, I have silver fillings. I don't have mercury fillings. That's the same thing, not understanding because their dentists have called them silver fillings for forever.
We should call them mercury fillings because they should
call them
mercury.
Absolutely. Yes, they should be called mercury
that's
fillings.
That's the more accurate term for them. There's a tiny little bit of silver in there, but
yeah,
mostly mercury.
Mostly mercury. And I think in history, we've actually really known the toxicity of mercury. If you think about Mad Hatter's disease, the hats were made stiff with mercury. And what happened to those people? They went crazy. Yeah. So see that in Alice in Wonderland. You're right. You have ongoing exposure of this off-gassing or vapor from your mercury fillings. And you're absolutely correct. Some people are like, I feel amazing. I'm not having any problems with these. And those probably are genetically like detox rock stars, right? Mm-hmm. But others, yes, you see a lot of brain fog, other neurological contributions like it can even be like nerve pain or some strange numbness or memory issues. I would say that's probably a big one. People like to think, oh, as I'm aging, it's normal to forget things. And yes, as we're talking about, forgetting your keys is normal, but not normal. I'll have people tell me, I forgot how to get to the store and it's a place that I go all the time. Is that normal? You're like, actually, no, that's not normal. We need to support your brain. And along with other things, Dr. Isabel, as you noted, that people will have other symptoms in their body related to their gut or their joints or just inflammatory conditions that get so much better when the source is removed.
Just side note, I've had several patients report that their eyebrows grow back.
That's fascinating.
After they have their mercury fillings.
Which could be thyroid, right?
My patient came and she said, I'm so excited because you gave me my eyebrows back. And I was like, whoa, I'm not sure I did that, but we can say I did. That's fine.
You'll be getting a whole new group of patients from you now.
Exactly. Oh my gosh. So yeah, I feel like metals they affect every pathway in our body. They're going to block those enzymatic pathways from happening. So it is interesting when you detox and how you feel. I went on my own detox journey. So if you listen to the first podcast that we did, I talk about my story and how I got into biological dentistry. And really, it started because I had excess mercury exposure from the dental office that I bought. The dentist had bottles of mercury, just pure mercury, and carpet. And that carpet was just off-gassing with all this mercury. He was just drilling. He had no assistant. So like he wasn't really using Then there was no suction in the office. He had no suction. I'm like, so he's just drilling this mercury without suctioning. It's going all on the carpet. And it was a dental office since the 50s. Okay, so I go into this office and then, of course, I just get sick. I'm just like covered in hives. Like I have to go to bed at 9 p.m. or else I'm exhausted the next day. I feel hungover. If I don't go to bed by 9 p.m. and sleep until 8 a.m., I feel hungover, right? I'm getting brain fog. I'm like forgetting things. I'm like talking and I'm like, what was I saying again? I have some thyroid stuff showing up and I'm like in my like earlier 20s when all of this is happening, right? And so I obviously, being who I am, was like, what is going on? I need to fix this. And doctors didn't have answers for me. So I started researching more. I found the IUMT. And then that's when I started learning more about detox. And so when I went through a lot of metal detox, I think it took me about 2 years of going in, and I did oral chelation, which is chelation is where you pulling the metals out. And then I did a bunch of IV chelation. And what I found was that once I detoxed the metals out of my body, I could go to bed at 11 p.m., wake up at 6, and I was totally fine. Didn't feel hungover. My energy was so much better. My thyroid levels started to get better. So I used to have low thyroid. It started to creep back up. I found that my brain fog was gone. I was a lot more sharp. I was quick. I was not stumbling on my words. And it's really interesting because I feel like a lot of people don't even realize that the metals are what are causing their symptoms. I always thought, oh, that's just how I am. Like, oh, I'm just the type of person that needs to go to bed at 9 a.m. or 9 p.m. I have to have my sleep. I could never do the all-nighters in dental school like all the other kids, all the other students. So it's just interesting because especially a lot of our patients come in, they've had mercury fillings in their mouth for 20 plus years. Like they have no idea what symptoms they're having. Oh, that's just normal. Oh, that's just because my mom was like that and I'm like, that's genetic. We blame all of these things and it's just normal. And the doctors say that you're normal, right? No doctor is really doing these tests to see, oh, how much heavy metal is maybe contributing to your health issues. We just don't really talk about it in Western medicine. And so I think a lot of it just gets completely pushed under the rug. We don't test for it. We don't talk about it. And so people just live with it.
So
and then they start to get other chronic diseases like Alzheimer's or Parkinson's. And you're like, how much of this could have been maybe prevented if we would have actually looked for metals? I feel like metals are just one of those fundamental things where everybody's going to have some high metals.
Totally. And they don't really factor in all the environmental toxins, especially if people are just not really thinking about how those metal particles can be in the air, in the soil, they can be in the food you eat, in the water you drink. Dr. Yeagley was sharing before we started the podcast that oftentimes when her patients get tested, they have high lead. They're like, not only lead exposure, I'm not picking up lead pipes or doing anything with lead. And it could be in the pipes of the house. You're drinking it every day. You're not even aware of it,
right? It also can be passed down for generations. Lead is crazy. There's studies that show in mice that I think 4 or 5 generations. So if your great grandmother was exposed from her pipes or the lead paint or whatever, that actually gets passed down and it's generational. Wild.
So that is crazy. Wild.
That's incredible. And then patients think that they just can take some cilantro and that will help.
Cilantro is great, but it really needs to not be the only thing that you're doing.
Because mercury is a heavy metal. So you need something that is going to bind to that heavy metal to take it out of the body. So I would love for you to talk a little more about it and then explain a little bit of, a lot of people might not know what chelation is.
Yeah, can we just go back just before that? Can we talk about diagnosing?
Yeah, because I was going to say, how do we test?
I think the first thing for patients coming in is, how do I know if I have an issue? And there's all sorts of different types of tests. And a lot of people bring in tests and I'm like, that doesn't tell me anything, So can you talk about how to diagnose it and what tests are the good ones and what tests are not really helpful?
Absolutely. Love to. So first, I just want to say there are actually human studies as well where they've done biopsies, of tissues, of arteries, of the brain, of organs. And based on those animal studies, you are absolutely correct. The exposure goes everywhere. It's going to be, those metals are going to be in your brain, and they're going to be contributing to cardiovascular disease, and they're going to be creating, essentially, they are a free radical. And I'm always surprised. I'm like, I'll tell patients like a free radical, and they're like, I don't know what that is. So we're like, something that creates damage, right? Or we call it an oxidant. Everybody knows antioxidants, right? Those are protective and healing. Oxidants in this situation are damaging. So yes, we're having exposure to those everywhere, not only the dental mercury fillings, but as Barry mentioned, like often in the water, in our fish that we're eating. Unfortunately, I'm at the place now where fish is extremely toxic, and you mostly have to avoid it just from a medical standpoint. It's very unfortunate because it's super delicious, but so we do have to think about the exposure, right? And then, so coming back to the testing, as we were discussing before we began, that your standard doc and I've noticed a lot of naturopathic doctors will just do a regular heavy metal panel through Quest or through LabCorp, and that is not
a blood test.
It's a blood test.
Okay.
It can be a urine test too, and it can also be just a regular quick urine. It can also be a 24-hour urine, and those are going to catch a little bit of what you're being acutely exposed to. So in the last week or so, if your pipes have lead at home, or if your
Stanley water bottle got damaged,
Stanley water
heavily
bottle,
damaged.
You
that's
ate some
right,
tuna
right.
fish.
You ate some tuna. I've had somebody refrigerator water. That's where she found her lead. I've had people they eat a lot of rice, so the arsenic is high. Yeah. People who work at Boeing, their cadmium is high. So you can catch things that are valuable. Yeah. What's interesting is I haven't yet seen mercury pop up in this test specifically related to fillings. If it pops up, they're eating a lot of fish. So you can't say, I have mercury fillings. My doctor did this test because I was curious, and I asked my standard doc, can you see if I have mercury? That's not good enough.
The thing with metals is that they don't just float around in our blood, right? Like metals, they go into fat tissue, right? It's a toxin. So the body's like, how do I get rid of this? I don't want it floating around in the blood, going to all of the cells, going to all my organs. I'm just going to try to push this into the fat. And that's why there's such a connection with neurological things, because the brain is all fat. And so those types of tests that are just testing blood, even the urine, aren't necessarily going to be showing you what's actually in your body. Hair is another test, right? A lot of patients come in and they're like, my hair test had really high mercury or really low mercury or whatever. And I'm like, that's great, but that doesn't tell me what's inside your body, right? That shows me what's coming out. So obviously, if you have mercury on a hair test, that tells me that there was mercury inside, but how much is still inside? We have no idea. And I've heard that like autistic kids have a harder time detoxing. And so if you do a metal test, a hair test on a kid that's autistic, they won't have any metals because they're all inside the body. So exactly. I see so many people come in with their hair test analysis, and I always having this conversation about how that doesn't actually show us what's in the body. That just shows you. In fact, if you have higher levels, maybe it's better because that means that your body's actually detoxing it out.
And we know in the hair tests, actually, they only certain forms, and I'm forgetting it because I don't use hair because I don't like it, but it only captures like organic or inorganic. I can't remember which one, but it's not capturing the full forms of the different metals that are in your body. So really what we want ideally is we want a chelated or a challenged urine test is what we want. And so what that means is that the doctor that's doing this test will give you either an oral or an IV version of a chelator, which is a binder of metals. So it's actually a treatment too, which is exciting. When you're doing the test, you're also getting a treatment that will go everywhere and pick up all of those different metals, capture them, and remove them from your body so it can be measured. So I really like Genova. They are a fantastic lab that has a very comprehensive panel that includes mercury. And I prefer at least an 8-hour urine, but depending on the timing of the testing, sometimes we'll go up to 24. So a minimum of 8 tends to capture exactly what we're looking for, because really that first test, we're looking for information so we can guide you on your next steps and the types of chelation that are available or treatments that are available. However, also, so if somebody is doing, say, I do know doctors that do unchallenged 24-hour captures, and we're really looking at exactly the same thing that we're getting through Quest and PacLab. We're not getting that deeper information.
Yeah. I have done many challenge tests during my detox journey. And one thing is you are going to be carrying around a pee jug with you. So I did not know this the first time. And I had a party to go to, a Halloween party. And so I was like instructed, okay, now you have to pee in this jug for 8 hours. And I'm like, oh my gosh. Okay. So I take this jug of pee to the party. And it was right when I met my husband. And I think it was Halloween and we met in September. So it was like a month and a half into our relationship. And I'm just like showing up to his friend's party with this jug of pee.
It's like a party
kind of
favor.
terrifying. And then also, just another thing for people that want to do this, it makes your pee smell really bad. So here I am in the bathroom, peeing into this jug, and it is so gross smelling. And I'm just like, I am so unattractive right now. And people are like, are you okay in there? Like, and I'm like, I'm good. And just put my jug under my costume.
I was wondering if you
needed a
incorporated
costume.
it into your costume. I'm a pee monster.
That's right.
Yeah.
You're like,
I didn't
incorporated
realize
into
I
the
had to do it
costume.
for so long.
Yeah.
So I did not incorporate it into my costume. And I did feel a little bit weird because it makes you feel a little brain foggy when you do it. I'm just like at this party, I'm supposed to be social. I'm like carving pumpkins. And I just told my husband, I cannot carve a pumpkin right now. You're going to have to do it. I'm just going to focus on my pee jug and drinking water. And I'll carve a pumpkin with you, okay? We'll share that responsibility. Yeah, that was, it's amazing that he stuck around.
I've had other patients share stories that are very similar. Like, I had to go to a party and I was peeing in my friend's bathroom, in their bathtub, like squatting, while everybody's barbecuing outside. It's okay to time your chelation.
Honestly, now I just own it. Like now I'm just like, yep, this is my pee jug. I'm peeing in this thing. It's going to smell. I am sorry, but I am not sorry. I'm owning it.
I think that's the way to go. Yeah, absolutely. Just tell everybody, this is my pee jug.
Yeah.
And it's coming with me.
God. So embarrassing.
So yes. So yes,
That's
you
fun.
can certainly tie. You could come in on a Monday. Most people aren't going to big parties on a Monday.
Yeah.
You get your chelation done. Yeah, but it's not so bad. You are peeing into we call it a toilet hat, which is also attractive, right? Another wonderful thing to have with
cute.
you.
That's all
Yes. And then it takes nowadays it takes 3 weeks for those results to come back. And then we start looking at treatments.
So basically you're saying like you have them pee initially and it's like, what are you acutely being exposed to? Then you're going into the cells like, hey, everybody, dump your metals. And so the cells are like dumping the metals and then you're having them pee for an amount of time. So then you compare those two results. So obviously if the mercury's really high in the first one and it's the same in the second one, then okay, well, that was probably an acute exposure from fish or something that you ate. But if you have a tiny bit of mercury and then you have a huge spike of mercury after you challenge it, that would be an indicator that, okay, we probably have some of that mercury built up in the body. Is that?
Yeah. The thing is,
accurate?
we don't really know, right? Because everybody releases their mercury differently. And so you are absolutely right that it's so common that I just warn people ahead of time that like when we repeat this urine test, the same one in 3 months or 6 months, it's probably going to be higher than your initial. And you're going to think, oh, this isn't working. This isn't helping. I'm worse. No, actually your body is getting better at excreting all these metals. And our third one we're going to see is going to be significantly lower.
It's kind of like an ant test. If you see an ant in your house and you're like, ooh, there's an ant there. I just saw one. And then the next day, 1 or 2. And then you're like, I got to go take care of this ant problem. And so then you go and find it and you're like spraying it and whatever. Like all those ants are going to flee, right? They're going to leave the scene and it's going to be like this swarm of ants, right? And then it's going to feel like it's more. But then after everything is done and they've all left, then you retest and you don't notice any ants in.
Yeah. the binding will work. The chelation does work. And part of this is like having a doctor that you trust, that is experienced in this, that can guide you in this journey, to reassure you, that it is leaving your body. And of course, making sure you're not having new exposures, getting the mercury out of your mouth. And as you mentioned before, preparing and making sure the body, all the detox pathways are working well. So
once you identify, okay, there's an issue, there's a couple of different ways you can do chelation or detox to get the metals out of the body. Right?
Yes, correct. Yeah, a few different ways. So people, sometimes I prefer IVs. They're going to be the strongest way and the most effective way of getting them out of your body. And the interesting thing is that the studies that are done, some major clinical trials that are done with chelators, are actually done where they take those chelators, they put them into vitamin IVs. And so that is our protocol as well. So anytime you're getting these binders, they're always going to be in a vitamin IV bag. So you're going to get minerals, you're going to get B vitamins, you're going to get vitamin C. And this is going to help your detox pathways with this process. So I would say always, if you're working with your doctor in this, they're just giving you the chelators. Some docs do that. Ideally, you ask them for a vitamin IV with it. So that's ideal. But there are definitely, for people, for whatever reason, maybe it's cost, or maybe they just really are afraid of IVs, that they don't want to do them. And so there is oral chelation. And so that's where we always want the combination of the two. The mercury chelator is DMSA, the oral version. The IV version is DMPS. And then you pair that with EDTA. As DMPS or DMSA is going to bind to mercury and pull it out, it's also going to start binding to all of your other metals. And that's what a lot of people don't realize. If they're only using, say, DMSA to just work on their mercury, it is a weak binder of lead, which is not good. Because if you weakly bind to certain metals, that means some of it's going to float around or get lost, right, as it's transporting around your body. So that's why people will feel 1,000,000 times better if you pair that chelation process with EDTA, which is your lead chelator, your lead binder. And what's really interesting is that when you look at this full panel of metals that comes out, both of those chelators very effectively, the DMPS or the DMSA will very effectively heavily bind to some of those, and EDTA does all the others. So they pair together really well. So you get a really nice, complete binding and treatment. So always recommend the two together. So orally, you can do both of those. DMSA is prescription through a compounding pharmacy. EDTA is, there are a couple of good brands. Like I like Quicksilver Scientific is a good one for EDTA. And then, as you mentioned, that some people will go, I'm just going to use cilantro, or I'm just going to use parsley, or I'm just going to use algae, right? Only, right? And it's just really, it's okay. I think if you're bringing those into your diet, that's fantastic. Make sure they're organic. You only want organic for those because they do bind to metals. And so if you're not getting organic, you're getting basically contaminated greens.
Charged,
there you go.
Cilantro.
Yeah, exactly.
Took it up in the soil. Detox that soil.
No extra charge. Yeah,
exactly.
For the mercury. But it's going to take you which likely it's not going to, it's going to take you a lifetime.
My understanding with cilantro too is that it like really mobilizes metal, but it doesn't bind very well. So you're just going in there and shaking it up and you're like, okay, mercury, get out of here. And then you're like, okay, bye. And then that goes then through the body, right? The body is trying to push that mercury deep so that it's not interfering as much. And the cilantro just jumbling it up. That's in my head. That's how I explain it to people. Because people sometimes feel sick. They'll eat cilantro. They're like, oh my gosh, I feel horrible. I can't even smell cilantro in the grocery store. If I even walk past it, I feel like I'm going to vomit. And you're like, you should probably have your metals checked.
That's a good point. That's an excellent point. Although there's a genetic thing with cilantro that where it tastes like soap. I don't know if you have heard of that.
Yeah, I've heard of that too.
I think all those food approaches too, the quantity of food, like of cilantro that you'd have to consume to have it make a impact. You're going to eat pounds of cilantro every day?
Well,
Disgusting.
I always tell people
that?
too.
Like a
I always
couple
tell
of
people,
cilantro leaves.
yeah,
not
no,
gonna do
you're
it.
not going to get it out with cilantro. Trust
I
me.
put cilantro on my tacos and I still...
That's
No.
good.
I
Probably
still
still have some
heavy
metals in there, right?
Come on.
Yeah.
You got to make sure your soil's good because you don't eat. Yeah, but yeah, I think that a lot of patients come in and they're like, "Can I just do this like herbs and food?" And I'm just eating more. I'm eating butter and I'm eating like these, cilantro, chlorella, whatever. And I always tell people like, look, food is awesome at helping us like bind and all that, but when somebody has put 50% mercury in your teeth that has been off-gassing for 25 years, that is not natural. That is not the way that our body is supposed to be. That's just not the environment that their body is supposed to be living in. So we have to bust out our big guns because we put big guns in there. Mercury is extremely toxic. It shouldn't be in our mouths. And so in order to get it out of our body, sometimes we have to raise the level and we have to meet it, right? We have to meet it with that. We have to be aggressive. And that sometimes means, in this case, it always means that we have to do chelation, right? We have to use different types of things to get it out. And it might make you feel a little bit sick at first. I know that for my detox, I told you about my pee jug story, but it makes you feel brain foggy, right? Like for me, I didn't want to do it like right before I had a big event. I learned at the party, don't do that. So as you start to pull it out, like some people will start to have some symptoms. And that's where it's really great to talk to your doctor about it because there's other things that they can do to help ease that detox.
Yes.
Right.
We love doing ours with glutathione, which is so fantastic. Such an amazing antioxidant that people feel so good with and really helps to clear the brain fog and gives you energy. So I highly recommend pairing a super antioxidant also with your therapies while also working on your gut.
Do you ever do any NAD in with the detox protocols?
We don't specifically, but that is a really interesting idea. We use it a lot for really moving energy and addressing chronic fatigue, especially if it's seeming to be a little more difficult, or we have a lot of things to work on, right? We found a lot of things. We found viruses, we found metals, we found a lot of deficiencies. Sometimes we will add the big gun NAD, vitamin B3 in its energy form.
Maybe I did that before the party. Would have probably helped.
Incredible. Yeah, it's incredible. But that is a really great point.
Idea,
yeah,
yes.
it's a really, I think I might start trying that.
Just because I know the glue push is really dramatic. Like
It's
you can feel
fantastic.
it. I love it. I love it so much. The only thing that I think you can feel more than a glue push is NAD. Like NAD, it's just like very dramatic feeling. In a lot of some stuff you can experience. And I know other people are more sensitive to these kinds of treatments. So I think as you were talking about when you're going through a detox, depending on like how your system responds, you might feel it more or less. But there are tools and things that you can add into the mix to help you counterbalance that. That are also just beneficial for you in a lot of other ways as well.
Yeah,
Yes.
It's all about support. I think that's really cool.
It seems too with the chelation and with the detox process that people have to be prepared mentally for the process.
Oh, yeah. Everybody's just like, oh, so I just go to the doctor and they just do a thing and then I take a pill and then everything's better in the world. And I'm like, it took me 2 years and I still need to work on my lead.
I know, which can be discouraging.
And also,
right?
I actually feel because of our profession, we're around so many chemicals all the time that I have to do detox as a maintenance thing. And I think most people probably, if you're eating the rice with the arsenic, if you're drinking the water, like all of that, you probably need to be going in and talk with your doctor about like how frequently you should be doing it, like tune-ups. But yeah, it is not necessarily a fast process, right? It took years for all of that to get into you.
It
and
will
then
take
and
years.
your body doesn't necessarily want to let it go. Like, you're getting in there and stirring up the pot.
As I think you mentioned that you actually did start feeling better it didn't take 2 years. It took like within several months, right? You're like,
Yeah.
oh my gosh, I'm getting clarity. I'm getting better rest, and
it just kind of happens slowly and gradually, and you're like, oh my gosh, I'm staying up till 11 and I'm waking up at 6 and I'm fine. This is crazy.
Yeah, you wake
know?
up one day and it's just everything's a little bit better.
Yeah, you just realize, oh, I think I am better.
Yeah. And so I think it definitely is a process to get it out. And I would say most people are on that 2-year timeline, but it definitely doesn't take 2 years for you to feel better.
Oh, definitely.
Usually within a couple of months.
For me, I wanted to have a baby at some point, and I was like in my early 20s. Now, like I was like later 20s, I think, by I figured it all out. But I was like, I want to have a baby. And through all of my education, I was like, whoa, I don't want to pass this to my offspring. And so I need to like really get serious about detoxing. And that's really what made me like on top of my health stuff. But I just thought that was normal. But the real driving factor for me was like, I feel so lucky that I know about this before I have a child. So let's do the detox before I have a child. And then when you get pregnant, you don't really want to be doing chelation,
you can't.
right?
Yeah.
So if someone's listening to this and they are like me who want to have a child and want to prep, like how far in advance, like you said, 2 years, how far in advance do they have to stop chelation before they try to conceive?
Yeah. I would probably stop a couple of months before, because really the half-life of the chelators that we're using are going to be out of your system within a week or so.
Okay.
We're okay there. And I've, technically somebody could get pregnant after that, really. But ideally, if we're really wanting to be safe and just going, okay, we're not, because you're absolutely right, we don't detox around pregnancy because you don't want to be moving anything. And so it's the same thing. People can do light detoxing as they're trying to get pregnant, especially if you have that window, right? You're like, okay, I'm not pregnant, I'm on my period. So you could do some detoxing while you're on your period, but that would probably be like a very gentle detox. You could technically do IV therapy during that time, but then maybe you would say, okay, I'm not going to get pregnant for this month. I'll wait. And then the next month we're going to try again. So really, it's out of your system.
How long do you think, like, if somebody did like six chelations, does that make a dent? Does that make a difference?
It would make a dent. Yeah.
So?
Yeah. There is a range of dosing too. So I have my standard starting doses and then we work up from there. So if you do well with that standard starting dose and you're like, I can only do just financially or my schedule, whatever, I can only do this like six times a year. That's all I can do. Mm-hmm. Okay, then let's get up to those max doses for every single one of your treatments.
And do you think it's important for men to also have
I think it's amazing for men to do it. Yeah.
Like
absolutely.
Before they have children, would that be ideal?
Yeah. There are studies that metals affect basically sperm vitality. And then, of course, men are also can experience brain fog and all those other things related to hormone disruption.
Specifically for like preconception, I think, because that was like my driving reason, right? I was like, I just don't want to pass on to my child,
I have a very specific, they swear these patients that I help them with detoxification. They were trying to have a baby and been trying for 2 years. I've gone through everything. And so let's just clean up your systems and do IVs and do chelation. And they were pregnant within 4 or 5 months.
I have heard this many times of patients that have gone through metal detox and they had fertility issues. And then after they've done several rounds of chelation, they were able to get pregnant. So that's pretty awesome.
It was pretty fun. For a while, they were like, you gave us our child. I'm like, I didn't give you. You did that.
That's awesome. And then also, obviously, if you're listening to this and you're like, I'm 50, I'm 60, I'm 70, I'm totally screwed. It's never too late. It's never too late to do chelation, to get the metals out. And what I love about connecting with Dr. Yeagley or Sage Clinic or any other office that does do chelation, sorry, I'm going to go back. I would say a lot of people do have their doctor test them for metals. And a lot of times what I find is that the naturopaths will, oh, that's not that important. Or, no, I did the blood test, you're fine. And I feel like there's a lot of naturopaths and functional medicine doctors that don't do chelation.
I think that's
and so
true.
if you have a doctor, if you're listening to this and you're like, I have a doctor and I've asked them, but they haven't really been that interested, or they've said I'm fine, but you didn't pee in the jug for 8 hours like I did, you didn't do that, then you probably need to have a different test. And I would say that I know lots of naturopaths and most of them don't do metal chelation. So it's really important that when you do this, that you go to a doctor who is experienced in it and who knows what they're doing. Because if you go to a doctor that doesn't know, they're either going to be like, it doesn't matter, you're fine. Or they're going to give you some supplements.
You're going to get some organic
and
chlorella
you're probably,
only.
like just maybe some chlorella.
Activated charcoal.
Yeah, some charcoal. They're not, which is not really going to be enough to really pull and actually do an active detox. So I think that's something I run into this all the time. And I'm like, look, I don't want to undermine your doctor. I don't want to put anybody down. But in my experience, you really have to go to somebody who knows what they're doing and is very comfortable with metal detox.
Agreed. And I don't understand why that is. I feel like it's a core tenet of treating the cause, right? And that's part of medicine in general. What's the cause? And especially if our goal as physicians is to help people live their best life, feel their best as they age, right? This is one of those core things that everyone has exposure to in our industrial society. It's ever present. It's ubiquitous. It's not a question. Do I have metals? I will answer that question for you. Yes, you have metals, my friend. Come in and we will find them and it's just part of how we live these days. But can you have metals and feel amazing? Yes, you can, because again, maybe you have all these other things that are going right and you have amazing genetics and your vitamins are like dialed in, right? And maybe you never had mercury fillings, which is fantastic. But it is, if you're dealing with any type of chronic illness, or you're dealing with memory issues, or you're dealing with chronic inflammatory pain, or you're dealing with chronic gut issue you can't figure out, you're absolutely right. This is a piece of the puzzle.
Yeah, and you're not going to be better in 2 treatments. Like, I think some people do a couple chelations, like, yeah, it just made me feel weird, and I just, I don't think it's helping. And you're like, okay, that's normal. Like, you have to push through it. That's what I found just personally doing it.
Well,
that I didn't love going in for the chelation. I wasn't like, oh, I feel like a rock star after. I was for a day. But I felt better overall. I knew that it was helping. I knew it was working because I saw changes in my symptoms, but it wasn't right away.
This is really how almost so many different positive changes happen and negative changes to the human body, where you gradually over time feel better or gradually over time feel worse. So you do have to make a commitment to it. Just like go to the gym or something. I went to the gym once, or hey, you know what? Dialed the food in for one day. But why didn't I lose like 15 pounds? I totally nailed it. I did curls yesterday. Where's my guns? What's going on? So commit to the process, but know that if you don't have the right test, you might not be making decisions based on accurate information. So part of it is get the right test.
And even the right test, like what Dr. Yeagley said, your levels might be higher after you start to chelate. I remember for me, I did a follow-up test. It was like, okay, in 6 months, let's do another test. I did another test. Guess what? My lead was higher. My mercury was down, but my lead was now higher. And I'm just like, oh my gosh, this isn't working. This is so frustrating. I'm literally coming in here. I'm spending money. I'm spending my time. I feel weird. I have to pee in weird jugs. Like, it sucks. And then you're like, this isn't working. And then you keep going. If you keep going, then you start to see. So then my lead started to come down. It was like, but that's exactly what happens. It was like the ants coming out of the nest when you bomb her. Just like, whoa. So it can be confusing. And this is why I cannot emphasize how important it is that you connect with a doctor who knows what they're doing when it comes to chelation. It is so important. And I hate stepping on other doctors' toes, but I feel like it's a subject that I'm really passionate about because I have gone through it myself.
Yep. And on the
It's
flip
so important.
Yep. And on the flip side, if you are getting your mercury fillings out or thinking about them coming out, you also need to be thinking about going through this type of process as well.
Doing it the right way.
And doing it the right way.
And I love what Dr. Yeagley said about everybody is different, because why wait until you have symptoms to do a test like this? You can have an amazing genetics. You can have an amazing diet. Everything can be great and you're not having symptoms, but that doesn't mean that those levels are high or they're low. So doing the testing is the only way to figure it.
Absolutely. This has been an enlightening and deep dive conversation on a topic that we address all the time in both clinics, and I think very enlightening and empowering and hopeful in that there are solutions for this, and there is something that we can actually make a big difference on as long as you know what to do, know who to do it with, find the right provider, and they can put you on a path to that healing place that we want you to ultimately get to. Thank you guys for being here. Remember, mercury is bad, your mouth matters, and there is a path to healing. We'll catch you on the next episode.